Minister of Labour and Immigration, Jason Copping. We have information to share on another important step we need to take to help contain the spread of the virus and protect public health and safety. And in addition, I have an update on the phenomenal success of the Bits and Pieces program we launched last week to mobilize businesses, civil society groups, and individuals in the production and donation of supplies and services needed to fight COVID-19. And Minister Copping has an important statement about changes to employment standards legislation that will allow for temporary changes extending job protection for workers laid off due to the pandemic and giving employers more flexibility to keep their businesses operating during the crisis. First, though, I want to update Albertans on the progress of the pandemic. As of this afternoon, the global number of reported infections is over 1.3 million, and the number of deaths attributed to the virus is approaching 73,000. Let me pause in speaking about the global numbers to send out my thoughts and prayers to the Prime Minister of the United Kingdom, the Right Honourable Boris Johnson, who's been a friendly acquaintance of mine for over 20 years. And I understand today he was put into the intensive care unit and his condition is deteriorating. And on behalf of Albertans, I would like to express our deep concern for his health and our best wishes for his recovery to the government of the United Kingdom and the British people. The Canadian totals are closing in on 16,000 infections and roughly 300 deaths. Here in Alberta, testing has confirmed 98 new cases over the past 24 hours, bringing the total to 1,348, and the number of deaths has reached 24 with an additional death over the past day. Encouragingly, the number of recovered cases has now reached globally about 275,000 and over 3,500 here in Canada, and almost 300 of which are here in Alberta, a significant increase since last week. The number of hospitalizations in our province remains low and manageable at 40, which includes 16 intensive care unit admissions. And I would say this is one of the most encouraging signs about our performance so far in Alberta with our high level of testing, but also the relatively lower levels of hospitalizations and ICU admissions. There was also some encouraging news from hard-hit Spain and Italy, which are both reporting that the rates of infection and death are slowing in those countries. Spain's health minister said that data indicates, quotes, a downward trend and stabilization. And although the United States is steeling itself for a very tough week, what the Surgeon General said would be analogous to Pearl Harbor, Governor Cuomo of New York said today that the death toll in his state has been, quotes, effectively flat for the past 2 days. We can be thankful here in Alberta that we have not seen anything like the numbers experienced in many of those other jurisdictions. Our relative success in controlling this spread is a tribute to the swift implementation of our effective pandemic response plan by Alberta Health Services, and to the skill, effort, and courage of our battalions of frontline health workers who are saving lives every day in the fight against coronavirus. They, in turn, are backed by regiments of workers who are providing our essential supplies and services, the truckers, grocery store clerks, pharmacy employees, childcare workers, and tens of thousands of others. And I want to thank those Albertans who have heard the message about reaching out and supporting all of those essential workers. I saw a wonderful story this weekend about a restaurant owner in Wainwright who made a point of reaching out to truckers stopping in town to offer them the use of his washroom and a free steak sandwich, and did so because he heard us make that call from this podium last week. So to all folks who in small ways are supporting those working hard to keep our economy functioning, thank you. These folks are an inspiration to me, and I think to all Albertans who are increasingly stepping up to join the fight. That includes, of course, practicing rigorous hygiene, staying home as much as possible, and keeping a safe physical distance from others. But as we noted on Friday, Albertans are stepping up in all kinds of other ways, big and small, to contribute to the fight. I mentioned that within a week of our emergency management agency establishing a program to accept offers and donations of supplies and services, such as protective masks, sanitizer, and trailers for medical use, within a week of them starting that, over 1,000 offers had come in. That phenomenal display of compassion and generosity prompted us to scale up the effort and rename it the Bits and Pieces program, which pays homage to Canada's success in harnessing the entire economy during the Second World War. Today, I'm pleased and proud to announce that the number of offers and donations that have come in through the Bits and Bytes program has nearly tripled to 3,000, just over the weekend. To illustrate how this is taking off, I'll just mention that Alberta Apparel, which had shifted production to protective gear, is now getting offers of donated fabric to make masks. This amounts to exponential growth of Alberta's COVID effort. And I want to thank all Albertans for their extraordinary kindness and generosity. Alberta Health Services and the Government of Alberta have been working diligently from the beginning of the pandemic to build a stockpile of personal protective equipment large enough to cover possible outbreak scenarios. In fact, we've been planning well ahead with a significant stockpile as a result of Alberta's well-exercised influenza pandemic plan. We're in good shape today, but to stay that way, I'm announcing measures to ensure that we have adequate supplies of the three main types of protective masks. First is the well-known respirator mask, the N95 or equivalent. These seal wearers against virus exposure and are critical for the protection of frontline health workers dealing with COVID patients, especially during high-risk procedures such as intubation. And we estimate that we currently have, based on the current level of usage and the projected, our models for projected usage, we believe that we have approximately 1 month's supply of N95 masks, but we are constantly seeking more supplies and ordering from suppliers around the world, and of course we hope to participate in domestic procurement efforts here in Canada and in Alberta. The second type of mask is a procedural mask, which is an effective barrier against transmission in most circumstances, used in ordinary medical settings. And we believe that there is an adequate supply of those in our health system as well. Lastly, there are low-protection homemade cloth or store-bought dust masks as a way to contain the spread of COVID or that can help in other ways. And Dr. Hinshaw will be saying more about the use of masks in her presentation. Let me just say that I have noted that the common factors of Asian jurisdictions that have been successful in limiting this spread, countries like Taiwan, jurisdictions like Hong Kong, Singapore, South Korea, has been high levels of testing, rigorous border controls and quarantine procedures, as well as very sophisticated tracking and testing. But as well, in all of those jurisdictions, quite widespread popular use of face masks, particularly in crowded environments. And so I'm pleased that there will be updated public health advice provided today on how people can safely use those masks in certain contexts to help to prevent the spread. And to assist with that, I'm pleased to announce that the Government of Alberta is undertaking a mass procurement of non-medical masks for future use by the general public. The health and safety of Albertans is paramount, and we want to take every opportunity to protect our citizens. It's very important for people who choose to wear masks to understand that if they are used improperly, they can actually increase the risk of infection. And I'm sure Dr. Hinshaw will reiterate these messages. Face masks can become contaminated on the outside or when touched by your hands. When wearing a mask, take the following precautions to protect yourself. Avoid touching your face mask while using it. Clean a cloth mask as soon as it gets damp or soiled. Put it directly in the washing machine or a bag that can be emptied into the washing machine and then to be disposed of. Cloth masks can be laundered with other items using a hot cycle, then dried thoroughly on the highest temperature setting. Non-medical masks that can't be washed should be discarded and replaced as soon as they get damp, soiled, or crumpled. And people should dispose of these masks in a lined garbage bin. They should not be left The discarded masks should not be left, for example, in shopping carts or on the ground as litter. I know this is a lot of detail to digest, but we're all learning a little bit more every day as the situation evolves. The actions we've taken to contain the spread have been effective so far, and the measures we're announcing today are designed to further keep Albertans' health and safety. I can also announce that on Tuesday night, tomorrow night, I will be delivering a televised address to the province, updating Albertans on the progress of our fight against COVID-19 and our plan of action for the weeks and months to come. Albertans want to know what are the real numbers. And so beginning tomorrow night, we will be providing some of the modeling done by Alberta Health Services that shows us when we might hit the peak and how well prepared we are for that. And I ask people to be prepared for what can be some very challenging numbers as we look at the prospective damage that this virus could still do in our province. On Wednesday, we'll be providing a more detailed briefing on the models and projections that are being undertaken by Alberta Health Services and overlay with that our ability to cope in terms of medical supplies and the capacity of our health system. The legislature will reconvene tomorrow morning and will consider, amongst other things, further amendments to the Emergency Management Act, many of them made as a request by municipalities, further to clarify their authorities relative to the provincial government and certain enforcement measures under the Emergency Management Act. We'll be continuing debate on the Mobile Home Act as part of our efforts to protect renters at this very challenging time for their finances. We will be presenting the modeling for COVID-19 to the legislature, and I'll be accountable to answer questions to Alberta's representatives at that time. And we may be considering a motion calling on the federal government for urgent financial backstop for Alberta's energy sector as the clock is ticking and we need to ensure a future for the largest industry in our province. Other legislation may also be forthcoming. The government House Leader will provide an update on that. And now I'll hand it over to Dr. Hinshaw.
Thank you, Premier. Good afternoon. Thank you for coming. As the Premier said, we have 98 new cases of COVID-19 in Alberta over the last 24 hours. This brings the total number of cases to 1,348. Of these, 361 people have now recovered. We suspect up to 204 of our total cases may be community transmission, an increase of 52 from yesterday. Sadly, as the Premier said, today we are reporting one additional death related to COVID-19, a woman in her 80s in Calgary Zone. This is the 11th death that has occurred at the Mackenzie Town Long-Term Care Facility. I want to offer my condolences to her family and friends and to the residents and staff of Mackenzie Town who are grieving the loss of so many lives. To do our best to control spread and to save lives, as you know, our provincial lab is doing a tremendous job completing tests. Alberta is second only to Australia in its testing rate. It is extremely important that in addition to completing as many tests as we can, we are also being purposeful in our testing. This means that the groups who are eligible for testing will change as we move through the evolution of the pandemic and as our testing capacity evolves. Our testing priorities should fulfill several objectives. First, they should allow us to diagnose and treat those individuals at greatest risk of severe outcomes, which is why we test all those who are hospitalized with respiratory illnesses. Second, they should allow us to trace the spread of the virus with a priority on those who are at the greatest risk of exposure and identify steps to limit the spread. That is why we seek to identify community transmission and transmission to frontline healthcare workers, including workers in continuing care facilities. And of course, who we test should provide us with accurate information about the effects our public health measures are having and help us determine if we need to take further steps. With these goals in mind, and with recent enhanced capacity in our lab to test more samples per day, we have expanded our testing priorities to include individuals with shortness of breath, runny nose, cough, fever, or sore throat who perform the following roles: group home and shelter workers, first responders, including firefighters, provincial and federal correctional staff, and those involved in COVID-19 enforcement, such as police, peace and bylaw officers, and public health inspectors. In addition, effective tomorrow morning, we are expanding eligibility for testing to anyone 65 years or older across the province who has fever, cough, shortness of breath, runny nose, or sore throat. Knowing that older Albertans are at increased risk for complications if they are infected with COVID-19, we are expanding testing access to enable early detection of infection in this group of people. Identifying infections in all of these groups will help us to prevent the spread to high-risk populations living in close quarters, more closely trace any community transmission among the testing groups, and provide more valuable information on the effects of our public health measures. Not everyone who feels sick needs to be tested. That is why we have set these priorities based on our current best information about the virus. I want to remind you that if you are feeling sick, your first step must be to stay home. Your next step should be to take the AHS online assessment. There is an assessment tool for the public and one for healthcare workers, enforcement, and first responders. So please take the assessment tool that is relevant to your situation. The assessment will then direct those who need testing to 811 for arranging a swab. Our knowledge of this virus and how it spreads continues to grow. One question that has been asked repeatedly is around the possibility of transmission from someone who is infected but feels well. This has been shown to happen most often in people who eventually get sick but may pass on infection to others in the day or two before their symptoms start. I have always said that asymptomatic transmission is possible, but that evidence from the tens of thousands of cases in China indicated that it was not a major driver of spread. What seems to be emerging from more recent data is that outside of China, this asymptomatic spread appears to be happening more often than we had thought. Our Canadian Special Advisory Committee has been looking closely at the evidence around this, and yesterday we determined that we need to expand our approach to take this emerging evidence into account in our measures. One of the major implications for this is the use of face masks by those who are feeling well. We discussed this on Friday after the CDC in the United States enhanced their recommendations, and I have been getting a lot of questions around the effectiveness of face masks for the general public. What we know is that people who are sick spread illness. We also know that even with more asymptomatic transmission happening than we previously thought, all of the recommendations we have made about keeping 2 meters distant from others, having close contacts of cases, or returning travelers stay home for 2 weeks from their last exposure, those recommendations are more important than ever. In addition to, not in place of, following all of that advice, there may be added benefit for those who are well and in places where they cannot keep 2 meters distant from others to wear a face covering. Wearing a non-medical mask, such as a homemade cloth mask, has not been proven to protect the person who is wearing it. However, it may be helpful in protecting others around you. This is because face coverings are another way to cover your mouth and nose to prevent respiratory droplets from contaminating other people or surfaces. Additionally, wearing a mask may stop you from touching your nose or mouth. If you choose to wear a non-medical mask or face covering, it should be well fitted and not gape at the sides. You should also be aware that masks can become contaminated on the outside. Avoid moving or adjusting the mask. After wearing the mask, assume that it has been contaminated and take the proper precautions. Critically, if you wear a mask, you must wash your hands before putting it on, as well as before and after taking it off. Cloth masks should be worn only a short time, as there is some evidence that they can trap virus particles after they become damp, which may put the wearer at greater risk of being infected. For those choosing to wear non-medical masks, it may be prudent to carry a bag with several clean masks in it, as well as a plastic bag that can be used to safely store used masks until they can be washed at home. It is critical that used masks be carefully handled to avoid spreading infection to others. The most important steps you can take to prevent the spread of infection remain the same. Consistent adherence to good hygiene, such as proper hand washing, following all public health orders, staying home whenever possible, particularly if you are feeling ill, and practicing physical distancing when you need to go out are the best ways to keep yourself and those around you healthy. These practices will become even more critical in the following weeks. As we see fewer travel-related cases, this is the time when community cases may start to rise. We must do everything we can to prevent the spread of this virus from person to person in the community. I know this is becoming increasingly difficult the longer this goes on, and especially with a long weekend coming up when normally people would be gathering together. But please continue to stay home. The less you are out in the community, the less chance you have of contracting or spreading the illness. Contact the AHS Mental Health Helpline if you are struggling, and reach out virtually to those around you who may need extra support. Even though we must continue to stay apart, we can and should continue to stay connected. I'll now pass the microphone over to Minister Copping.
Thank you, Dr. Hinshaw. These are unprecedented times, and this is an extremely difficult time for all Albertans. Our government is doing everything it can to help contain the spread of COVID-19, and my heart goes out to the families and friends of those who have already been affected by this disease. It is important to remember that we are all in this together. This public health crisis has been difficult for all Albertans. That includes employees and employers across our province. We've heard from employees who are concerned about their jobs, and we've also heard from businesses that it's challenging to operate under the current standards during this unprecedented health crisis. That's why today I am here to announce changes to the employment standards legislation that will ensure Albertans can care for themselves and their loved ones during these challenging times while providing flexibility to Alberta's job creators. We are putting temporary employment standards rules in place to provide protection for workers and flexibility for job creators during this pandemic. A lot has happened in the last 2 weeks, and we continue to work to support Albertans at this time. That means making sure Albertans don't have to choose between taking care of their family or losing their job, by ensuring employees can take the time they need to deal with the impacts of COVID-19. We are announcing today employees who need to care for children affected by school and daycare closures or caring for an ill or self-isolated family member due to COVID-19 is entitled to unpaid job-protected family leave. We have waived the 90-day employment requirement, and the leave length is flexible based on the advice of the Chief Medical Officer. And this applies to any Albertan who took time off to care for family on or after March 17th. Now, we know a number of businesses have unfortunately made difficult decisions to lay off people, and I know this isn't easy. We don't know how long we will be in this position, and we want to ensure that every temporarily laid off worker can stay attached to a job. And that is why we are increasing the maximum time for a temporary layoff related to COVID-19 from 60 to 120 days. This change is retroactive for any temporary layoff due to COVID-19 that occurred on or after March 17th. And these temporary measures will give employers the flexibility they need to make it through the pandemic and will allow for sustainability and help with recovery once we get through this and to get Albertans back to work. As the situation continues to evolve, we are making sure we adapt and do everything we can to get Albertans through this. We are improving scheduling flexibility by removing the 24-hour written notice for shift changes and the 2 weeks notice for schedule changes for those under an averaging agreement. Instead, job creators will be required to provide notice of a shift schedule or changes as soon as practical. These will help employees and employers adjust workforce needs due to these rapidly changing circumstances. Many employers are having to quickly reduce staff and limit operations. And providing the required 8 to 16 week notice is not practical. To address this, we are also removing the requirement to provide 8 to 16 weeks notice when 50 or more employees are being terminated at the same time. Employers are still required to provide notice to me for group terminations, and individual termination requirements continue to apply. These are not easy decisions, but necessary decisions to ensure we can recover when this is all over. Finally, to help workers and employers respond quickly to changing conditions at the workplace, we are streamlining approvals related to modifying employment standards. Now, these changes take effect immediately and will stay in place as long as they are needed and the public health emergency order remains. These changes are temporary and a response to the current situation our province faces. This is a difficult time, and I want to thank all the workers and job creators for making the necessary adjustments to keep the workforce and the public safe. By making these temporary changes, Alberta's workplaces can stay viable, and Albertans can focus on those items that matters the most at this time, their health and family, because we are all in this together, and together we will get through this. Thank you.
Okay, we'll open it up for questions. Operator, can you put through the first caller, please? Or not? Janet, do you have a question?
I do. So actually, this is for the Premier. I just got off the phone with a gentleman from Calgary who's an electrician, and he was one of the people that wanted to apply for one of these emergency support or the emergency isolation payments, was unable to get through on the phone or the website for the entire duration. Said he was absolutely shocked this morning when he saw that they were cut off. What would you say to people who really needed that money now, who thought that there had been a promise to bridge the gap by your government?
So the commitment was until the federal government program came into place. That starts today. This was to bridge people until the federal program. As you know, we had some technical problems with the website that was never built to handle the kind of demand that we received. So when we go back and learn lessons from this period, we'll obviously have to invest more in expanding the capacity of the provincial government website to handle tens of thousands of concurrent applications. I understand that we had initially budgeted $50 million for the emergency isolation payments. We have now dispersed $96 million, and I gather that Service Alberta is going back and reviewing some of the people who applied initially but weren't able to get through, weren't able to get their applications processed. We anticipate when all of that's done that the total disbursements will be in the range of $106 to $110 million, so more than twice as much as has been budgeted, and that something in the range of 90,000 people will have benefited from it. So the program turned out to be twice as large and twice as generous as anticipated. I regret for people that didn't get through the system, that the system simply wasn't set up to cope with those demands. The federal government program now begins as of today, and I understand in order to avoid a similar problem from their system crashing, they will be going sequentially based on the letter of people's last name. So the federal government has a similar challenge in terms of just the limited capacity. Frankly, no governments have been through this kind of demand for social payments since, well, in decades, since we've had online technology. So this is uncharted territory, and I'm pleased to be able to report that a program that was designed at $50 million is dispersed by the end of this probably $110 million in support.
Operator, can you put through the first caller, please?
Yes, we have Robert Tuttle from Bloomberg News. Go ahead, Robert.
Yes, hi, Premier. I'm wondering regarding this upcoming, looks like a G20 meeting. For one, I just want to double check, is Ms. Savage going to be participating in that? And also, what role do you think Alberta can play in this? I mean, if you can't really do much because you're landlocked, what could Alberta do to control the situation in the oil market?
Well, first of all, I can confirm that Minister Savage spoke by telephone with the Secretary General of OPEC yesterday afternoon and has been invited to and will participate in this Thursday's scheduled OPEC Plus conference call. We will clearly state our position that the decision by OPEC to surge supply in the face of an unprecedented collapse in energy demand has been grossly irresponsible, has created chaos in energy markets, and jeopardizes millions of jobs here and around the world. We will call on OPEC and OPEC Plus partners like Russia to do the right thing and to stop flooding global markets, which are just going to force inventories to tank tops and force massive shut-ins of energy production, which will have huge negative economic repercussions for Canada and many other countries. I continue my conversations with policymakers in the United States, this morning speaking to members of the United States Senate, to discuss the possibility of coordinated North American action against the predatory dumping of energy on global markets by OPEC+. And so I will be conveying that message very clearly. We appreciate the invitation to participate. If we do see a willingness to engage in large-scale production cuts, we'll assess whether or how Alberta could play a role in that. Minister Savage reminded the Secretary General of OPEC yesterday that Alberta has been under production curtailment since January of last year, and that we are really constrained in how much we can ship to global markets anyway because of a limited pipeline capacity. So we appreciate being at least included in these conversations, and we'll continue to convey that very clear message. As I've said before, OPEC and Russia started this fire, and it's their responsibility to put it out.
Go ahead, Julia.
Hi, this question is for Dr. Hinshaw. I'm just hoping you can clarify when it comes to masks. Should the average Albertan, when they're out and about, be wearing masks, or is it only if they're confined to these smaller spaces where they can't have the 2 meters separating them from someone else? And also, do you think we should have been doing this sooner? What type of impact do you expect it to have?
Sure. So I would say that for the average Albertan, if in their day-to-day course of their activities, they are always 2 meters apart from everyone else, that wearing a mask would not provide any added benefit. And because there are some potential, again, possible harms of mask use, that this would be something that only those really who are going to be in situations where they can't avoid coming into closer contact with people, that it would be more valuable in those situations. And again, the use of a face covering in those general public interactions is really about protecting everyone else from the person who's wearing the mask, because it's really about making sure that any respiratory droplets that might be produced when someone is speaking, when they're out and about, that those droplets are contained. So again, really focused on those situations where people can't avoid closer contact with others. I want to be clear that in healthcare settings or occupational settings where there is that risk of encounter with someone who's ill, that's a different category, and that's always been the recommendation with respect to wearing masks in those encounters. And in those encounters, it is a mask combined with other personal protective equipment and other engineering controls to prevent that spread of infection. So they're two different situations. With respect to how quickly this recommendation was made, one of the things that's important to me as we plan our response and as I make my recommendations is to make those based on the best available evidence. Certainly there are countries that had moved ahead with cloth mask recommendations earlier. We know, again, from our review of the literature that does exist, that cloth face coverings, again, can have some risk. And so I think that it's important to make sure when we are making a recommendation or providing advice, that it's based on a review of the best evidence possible and that we don't move so quickly towards something that we potentially put people at risk. And so that, again, was important to me, that we review all evidence available. So I think there will be many lessons learned at the other end of this response, and I'm sure there will be opportunities to understand the timing of when we did things. But what we have always done in Alberta is made the best decisions we can with the evidence that we have at the moment and continually assess that evidence and the need for making any further changes. And we will continue to do that.
Operator, can you please put through the next caller?
Next question is Emma Graney with the Globe and Mail. Go ahead, Emma.
Yeah, g'day everybody. This question is for the Premier. Got a bit of a question here about medical services. So basically, since April 1st, there's been plans to kind of stop services, especially, but not exclusively, rural. You've probably seen those stories floating around. But what are you going to do about doctors that are rolling back services at hospitals or leaving? The response in the past has been, you know what, we'll fill the positions, we'll find people. But where are you going to find people who don't necessarily want to come to Alberta right now?
Well, first of all, if a physician wants to withdraw their privileges from Alberta Health Services at a hospital, for example, they have to give, I believe it is 3 months' notice. That gives AHS that period of time to plan. I understand a lot of family physicians, of primary care physicians right now have seen a significant reduction in their billable income because people are not going to clinics anymore for I think obvious reasons, and I suppose a lot of the people who might normally have come in personally have not converted yet to the online telehealth consultations that we are now facilitating through telehealth building codes, which are equivalent to a walk-in code. So I can understand that many physicians may be seeing a decline in their income, and that's unfortunate. That is also true right across the entire economy. There are tens of thousands, if not hundreds of thousands, of businesses that have had to shut their doors altogether. And so this will be trying times for all kinds of small businesses, including professional corporations of family physicians. But in terms of the broader response on human resources, I would refer you to Dr. Verna Yu, the President and CEO of Alberta Health Services. With a lot of people not operating in walk-in clinics, for example, there are additional people available, and Alberta Health Services is confident that they can ensure continued service in those hospitals and clinics.
Go ahead, Tom.
It's for the Premier as well. Thanks for taking my question. It's about the modeling release numbers and
Sure.
and kind of the schedule of the way it's going to go. Like, will it be debated in the House, presented in the House, and what does this televised address look like? What time in that?
So Tuesday night, tomorrow night, I'll be presenting some of the key points from our modeling, giving Albertans a sense of where we think we're headed and how we're going to cope, how well prepared we are, and what the plan is for the months to come. I think a question a lot of Albertans just want to know is, when is this all going to be over? We will not be able to answer that with certainty, but I think we can give people a sense of when we think we might be able to begin to relax some of the public health orders and social distancing protocols, and hopefully get back to some kind of a normal and to begin to restart the economy. So my televised address on Tuesday night will partly be about that, but also about the enormous economic challenges that we are facing as a province. As I often say, it's a triple whammy: the public health crisis, the shutdown of much of our economy, and then the worst energy prices in our lifetime, all of which are making it especially tough for Alberta. That'll be the focus of my speech, and hopefully a sign of hope and a plan for the way forward. On Wednesday, I'll be providing, I and Dr. Hinshaw, folks from Alberta Health Services, and others will be providing the full compilation of our modeling. So it will be a dump of all of the pertinent data. And will be available to the media for questions, and I will then present the same data to the legislature and be available there to take questions as well. We want to be as transparent about this as we can. I've been asking for modeling now since this began, and we've already seen some significant changes in the projections, I think on the good side. And while there will be some disturbing worst-case scenarios, I think Albertans will see that because they have been responding so well to the public health orders, to social distancing, to good hygiene, that we are in a much better position than similar jurisdictions around the world, and we hope to stay in that position. So I think that will be the takeaway from the data that we present on Wednesday. I remind people in advance that our models are not a perfect prediction of what will come. It's our best effort to paint a picture. That's important for planning purposes. We'll also be presenting folks with a sense of what the maximum capacity of our healthcare system is when we hit the peak and beyond. And you know, that's what the battle plan basically is. It's to push down the curve through everything that we are doing while expanding the capacity of the health system and ensuring that we have adequate supplies. And I think I'll be able to report to Albertans on Tuesday and Wednesday of this week that so far we are on track to meet those goals.
Operator, can you please put through the next caller?
Next question is Kevin Nimick with CTV. Go ahead, Kevin.
Hi there. We're hearing from pharmacists who don't have access to PPE, but they've been told they will soon be able to access the provincial supply. When is that happening, and how imperative is it that pharmacists have the proper protection?
Yeah. Thank you. So the Alberta Emergency Management Agency is responsible for procuring personal protective equipment for essential service workers who are outside AHS, outside the healthcare system proper. And that would include pharmacists. So Deputy Minister Paul Winnick and the Executive Director of the Alberta Emergency Management Association, Shane Schreiber, are at the Provincial Operations Centre with their own complementary efforts to procure things like N95 masks and other personal protective gear. I can tell you they're having some early success. We hope to see a large-scale shipment in the days to come of N95 masks that would be available in part for workers like those, like our police services, prison guards, homeless shelter workers, pharmacists, and others. So we'll be happy to, on our big briefing on Wednesday, we'll have somebody here from the Provincial Operations Centre who can provide a more detailed update. But let me tell you that we do have a dedicated procurement track for PPE for pharmacists and other folks who need to stay safe in the weeks to come.
Operator, can you please put through the next caller?
Next question is Kevin Armstrong with City News. Go ahead, Kevin.
Hi, Premier. A question in regards to if there's any concerns with the weather finally changing here in Alberta and warming up. We've seen in other jurisdictions warmer weather brings more people out. I'm looking at a City of Edmonton release right now that has well over 300 verbal warnings that were released over the weekend. We've got a long weekend coming up, weather improving. Are you concerned about that, and would there be any additional measures?
Well, yes, we are concerned. That's one of the reasons why we have banned vehicle traffic into our provincial parks, because 2 weekends ago we saw some nice weather. It was the first weekend of the social distancing measures, and we saw a huge number of people going out to the parks. We saw as traffic that on that weekend, which was as large as the May long weekend traffic typically is, and that's the biggest weekend for visits in provincial parks around the province. We saw people, in too many cases, being reckless, moving in large crowds, doing things that were jeopardizing the safety of our provincial park employees. And that's why we made the tough decision to suspend vehicle traffic to the parks. We will also be announcing a series of measures this Thursday to control to prevent the possibility of wildfires. That will include a fire ban in various areas of the province before we get to this weekend, because, to be blunt, we are quite concerned about the possibility of managing this pandemic and then having a lot of wildfires at the same time, like we did last summer and spring. Those wildfires could severely affect air quality, which could complicate the physical condition of people susceptible to the coronavirus. So we're going to do everything we can to prevent wildfires. We're going to start up our our fire tower observation centers earlier than normal, our helicopter overflights, and registration of off road vehicles, as well as a fire ban in most wild areas of the province, and other measures that we'll be announcing on Thursday. So we would just ask people, please, even if I know everybody's getting a bit stir crazy and they're tired of being stuck at home, and people want to get out and enjoy the beautiful outdoors, especially when spring starts, but just once again ask people to please, this is a critical moment, an absolutely critical moment. You will hear in our presentation later this week that we expect the peak to hit several weeks from now. And how high that peak goes then depends a lot on how people conduct themselves now and this weekend and the weekend to come. So nice weather is not a license to go out there in large groups. I think this is probably a bigger challenge in the city parks, and the mayors and councils of the two cities have been very clear about this, to keep that distance. And now we're hearing from Dr. Hinshaw that people may also want to consider wearing face coverings to prevent the spread as well. So folks, enjoy the weekend. Hopefully you've got a patio or a deck in your apartment or a backyard. That's probably the best place. But if you want to get out for exercise, you can do that. Just keep that distance and stay safe.
Operator, can you please put through the next caller?
Next question is Mirna Juchik with Radio Canada. Go ahead, Mirna.
Yes, thank you. My question is for the Premier, Mr. Kenny. J'aimerais revenir sur les Albertains qui ont perdu leur emploi donc à cause de la COVID. Il y a plusieurs prestataires de AISH ou de suppléments du revenu qui occupaient des emplois à temps partiel puis qu'ils ont perdu donc ces emplois. On ne peut plus accéder à l'aide provinciale. Et il y a des provinces comme la Colombie-Britannique qui leur offrent de garder leurs bénéfices même s'ils accèdent à l'aide fédérale ou qui augmentent leurs bénéfices. Est-ce que l'Alberta envisage une option comme celle-ci ou sinon, est-ce qu'elle envisage une autre option pour les aider?
C'est la première fois que j'ai entendu dire de ce problème-là ce matin et j'ai demandé auprès de mes fonctionnaires une réponse. Nous allons considérer l'impact de ces paiements sur certaines personnes qui ont perdu leurs emplois. Je peux vous dire que les paiements d'urgence pour les gens qui ont été en isolation, ici en Alberta, on a versé plus de 100 millions de dollars vers les gens en isolation. Alors ça c'est 2 fois plus grand que les paiements prévus auparavant. Et nous avons annoncé plus de 10 milliards de dollars en aide économique ici en Alberta par le gouvernement provincial, y compris le fédéral, a annoncé plus de 100 milliards de dollars d'aide économique et financière pour les Canadiens. Alors, les gouvernements ensemble ont fait énormément au côté fiscal pour aider les gens qui ont perdu leurs emplois, mais évidemment, il y a toujours les gens qui continuent à souffrir les conséquences de cette pandémie.
Operator, can you please put through the next caller?
Next question is Tara Weber with BNN. Go ahead, Tara.
Hi there, Dr. Hinshaw. I've heard that there have been some first responders that have tested positive. I'm just wondering if there's numbers of police, fire, and EMT that have been.
So I do not have that number handy. And with respect to how we track provincially the test results, typically it's more about if the people were close contacts of known cases, if they were community acquired, or if they previously were travel acquired. So we do have some work underway to track healthcare workers. So the emergency medical technicians would likely be captured within that group. But the police and firefighter group, we have not had an administrative way of tracking those particular numbers. So I can take that away and see if that might be possible, but I suspect that in order to get those numbers at a provincial level, it would likely be a hand search of the written comments within each of those files, so it may not be something that we're able to produce.
Operator, can you please put through the next caller?
Next question is Rafi Bouchakanian with CBC. Go ahead, Rafi.
Hi, Dr. Hinshaw. I'm just wondering, do we have protocols for when an ambulance is dispatched to someone's home for a COVID-19 call? And what do those protocols say in terms of deciding then and there when the caller should be or shouldn't be hospitalized?
So I'll tell you what I know about that, and then probably be able to get some more detailed information offline. But the information that I have is that when somebody is known to be positive for COVID-19, or if they have compatible symptoms, travel history, if they're, for example, a close contact and they're waiting for test results, if they are feeling that they need some kind of medical attention, they can call if they're feeling that their symptoms aren't just mild and that they're worried about their symptoms becoming more severe, they can call 911 and very clearly disclose that they've been tested for, or maybe they're positive with COVID. And that teams of paramedics are able to, depending on the location of the province and how many resources are available, but teams can go to people's homes across the province, and in some cases they're able to do an assessment with a physician who's supporting that team to determine whether or not the symptoms are severe enough to require hospitalization. And if they are, then clearly that person would be taken to hospital. If they're mild and just requiring some additional supports that can be provided at that point in time, then again, in consultation with both the patient and also with the physician who's supporting that team, then a decision is made with respect to what the best place for that person to go is. So again, I'm happy to ask Alberta Health Services if we can get a copy of those protocols, but that is the information that I have at this time.
Okay, we'll take one last question. Operator, can you please put through the last caller?
Yes, next question is Blake Law with Global Calgary. Go ahead, Blake.
Hi there. This is a question for Dr. Hinshaw. Appreciate the clarity around face masks. I was just going to ask about gloves. First, what is the current guidance for essential businesses that interact with the public, like at grocery stores or drive-through workers? Should they be wearing gloves? And just following up, is it necessary at all for the public to wear gloves if, for instance, they're going to the grocery store and maybe handling food items? Just looking for the current guidance on that.
Sure. So glove use really depends on what context and what people do while they're wearing gloves. Because if you think about it, essentially you're just putting a layer over your skin. But if while you're wearing gloves you touch your eye or you touch your nose, it doesn't really matter that you're wearing gloves or not. That same exposure risk happens whether you have gloves on or whether you don't have gloves on. So I would say that if someone is wanting to consider wearing gloves, they should wash their hands thoroughly before putting gloves on. And then while they're wearing gloves, remain as mindful as they normally would be about not having their hands anywhere near their face. And anything that they touch, again, if they pick up something or they touch a surface that might be contaminated, and then they touch their purse or something that they're going to touch again when they've taken those gloves off, the gloves don't do much good. So really the gloves are only for wearing within a defined period of time, and while they're being worn, the person shouldn't be touching things that they're then going to handle with ungloved hands, because that defeats the purpose. So I would say, again, I wouldn't recommend necessarily for or against glove use, but would just say if people do choose to use them, they need to be thinking very carefully, in the same way they would if they didn't have gloves on, what they're touching, making sure to stay away from their face, and making sure to wash hands thoroughly before putting them on and after taking them off.
Okay, we'll leave it there. Thanks, everyone.